All right, we are here with Dr. Tyler Sbrocchi at CAPS, who's a board certified plastic surgeon within CAPS. And I was looking at your bio when you go through going to Ohio State, doing a residency as a general surgeon, then doing it with plastic surgery. How long have you been in school?
I lose track sometimes. It feels like forever. So 4 years of college at Ohio State, like you mentioned. And then 4 years of medical school. That was at University of Toledo, which I'm from. And then 5 years of general surgery residency, actually in Columbus here at Riverside Methodist Hospital. And then another 3 years of plastic surgery residency at Ohio State. So 8 years of training, but life, they always say lifelong learning. So you're always kind of learning the newest techniques and newest innovations in plastic surgery and implants and different modalities we use to help patients achieve their goals, all those things. So kind of a lifelong learning.
It is lifelong. So people know what they want when they come into CAPS and when they see you. So what is kind of your most favorite thing and procedure-wise with your patients that you do here at CAPS?
Yeah, that's a great question. I truly, it sounds a little generic, but I truly love plastic surgery just from top to bottom, and I love that aspect about it, that we can operate from head to toe. Enjoy upper blepharoplasties on the eyelids, facelifts, breast augmentations, breast reductions, tummy tucks, anything that we do that helps patients gain their confidence back. Truly, that's why we all get into it, or at least most of us really continue to enjoy our work every single day. So it's hard for me to pick just one.
It's picking your favorite child, isn't it?
Yeah, exactly. I guess my preference, tummy tucks I think are great just because we see such an immediate relief from patients and just that confidence changes almost instantly. Same with breast reductions and augmentation. So those are really a lot of instant gratification, but also long-term. So those are some of the favorites.
So with your favorites, what do you want some patients to know, or what don't they know maybe about your specialty in these different procedures that you do?
Yeah, so I think just kind of the wide variety of things that we do at CAPS as plastic surgeons, and then that too, that we all do them a little differently. So that's why consultations and meeting with your plastic surgeon, who's board certified and has experience, is so important, because each surgeon does things a little bit differently and has their own kind of signature on an augmentation, a lift, a tummy tuck, all those things. And so you really get that feel for what you're getting out of your plastic surgeon when you meet with them, and then what you can expect your results to be after that.
So what would you want to tell a patient who is planning on coming or thinking about coming, and like you said, knowing what they want? What's the one thing you have to tell every single patient when you see them?
Oh, I think everything you have to tell a patient is setting expectations. So I think, having them do research beforehand, getting some idea, but as our goal, one of the main ones as a plastic surgeon, is set that expectation for the patient, no matter what procedure, and some of those favorite ones we talked about afterwards. That's one of the most important things we can do, is so that when you wake up from surgery and you go through this huge process and commitment, you're really happy with your results at the end of the day.
So that's awesome.
Yeah.
Well, I'm going to switch gears on you too. So we know what you do here at CAPS, but also what you're featured in and you're a big part of is the CAPS Foundation. So that truly helps patients, and kind of explain what you've been involved with the CAPS Foundation and patients who are either had breast cancer or treatments that they've gone through. Yeah,
absolutely. It's one of the most special things about our group at CAPS. And the fact that we continue this kind of effort of giving back and creating this community. So for me, I do a lot of breast reconstruction in our practice, whether it's new breast cancer patients, revision patients that have had cancer surgery even 15, 20 years ago. I get to connect with them lifelong almost at that point. So that's been really special. And then just taking them through that journey. I have so many of these breast cancer patients that when they start, it's very scary, rightfully so. They're getting a lot of information, there's a lot of doubt, a lot of worry. And then when you see them at that finish line, when they're kind of done, hopefully with that first stage and second stage of reconstruction, there's this huge weight lifted off their shoulders. And when they come in and talk to me, they're like, you mean I don't have to see you like every week or every month? It's almost like a shock, and it's like, this is a good thing you've made, kind of to the finish line. Now, there's obviously things we do later on for them too if they need it, but it's really special to be able to see that. And then things we do at the CAPS Foundation, like cold capping to help prevent hair loss during chemotherapy, nipple tattooing and reconstruction is another one. So just being able to offer our patients so many more options than just reconstruction,
right.
it really kind of encompasses what we envision for ourselves at CAPS, and to connect with patients on a holistic level.
So it makes them feel like themselves
100%.
going through what they're going through.
Absolutely, it's tough.
So if they know you on that personal level,
Yeah.
let's see what your CAPS family thinks of you.
Oh,
So
yeah.
if you had one word
Oh,
that
boy.
your staff and
Yeah.
people you work with at CAPS would describe you in, what is that one word?
Oh gosh, hopefully I would say humorous or funny.
Okay,
Yeah.
there we go.
I try and keep things, like, obviously it's a very serious profession,
Yeah.
and when I'm with patients or operating, but I think connecting with patients on a level, and if I can get patients to laugh with me, or especially if they're going through a tough time
Right.
or something like that, I try and keep things a little light. Surgery and life can be really tough sometimes, so trying to bring a little bit of that in is helpful.
The funny,
Yeah.
humorous one. There we go.
Try, yeah.
Slash, a word and a slash.
Yeah.
So now we have our rapid fire
Oh, yes.
questions.
Okay,
We are
great.
going to ask for you, and this is just to get to know you
Yeah.
as the plastic surgeon here at CAPS and what
Sure.
people will go. So we did the one word, and you
Yeah.
can think about this, but off the top of your head, are you ready?
Yeah, I'm ready.
What's your go-to comfort food?
Oh, Italian.
Okay. What's your favorite movie you never get tired of?
Oh gosh, probably. I may have to think about this one. I think any like old 2000s comedy.
Oh, okay.
Yeah, it's hard to pick just
like
one.
with the
that
Ben Stillers,
yeah,
American
so
Pie.
yeah, kind of like some of the you just on TV, just a Saturday
Yeah.
afternoon, just kind of in the background. My wife asks me all the time, like, we have to watch this again. So I think some of
Well,
those.
so you mentioned your wife, and you
Yeah.
also have little kids. What is the go-to children's TV show that is on at your house?
Whatever my daughter decides in the moment. Yeah, right now it's a big Bluey.
Okay,
household.
Bluey and Bingo.
Yep, that's a big one. And then she's very into Halloween, and my son
Oh.
loves pumpkins. So right now it's any kids, Halloween.
Halloween all year round?
Yes, yeah, very much.
Okay, so back to you. Sweet or salty snacks?
Ooh, sweet.
Early bird or night owl?
Both. I think as a resident surgeon, you kind of have to be a little
You have
bit,
to?
but yeah.
Okay.
Both.
Beach vacation or mountain getaway?
Oh gosh, I'd say with kids beach, but if it was just my wife and I, mountain.
Mountain, okay. What's your favorite season then of the year?
It's slowly becoming fall.
Oh,
yeah, it used to be summer, but
it
now
is
it's
an autumn,
fall.
as
Yes,
they say.
yeah.
You know that one.
Yeah.
Cat or dog?
Dog.
What hobby could you do for hours?
Oh, tennis.
Oh, okay. What's your favorite holiday?
Christmas.
Coffee or tea?
Coffee.
What's the most recent TV show you binged? Not for your kids.
It was 4 seasons on Netflix.
Oh, you
Yes,
did? Okay, so
I
it
did,
is
yeah.
a recent one then.
Yeah, it was fairly recent. Yeah, found some time when they were asleep.
When they were asleep,
yeah.
so there's the night owl part
Exactly.
of it.
Yes, exactly.
All right, what's one food you absolutely cannot stand?
Oh, it's gonna make me sound like a kid too. Probably broccoli.
What?
I know. I tried. I just never been a fan. Yeah. It's not horrible, but if I have a choice, I'll push it off to the side.
You're never gonna make your kids try to eat broccoli.
No, I can't. Yeah, I can't make them do it. Yeah.
All right, so we're gonna go to the final one. What's a smell that instantly makes you happy?
Oh my gosh. Probably like some sort of candle that brings you back to fall football season, apple picking, pumpkin, and then Christmas, anything that brings you back to kind of like your childhood holidays, and just
you are
those
such
old
a
memories.
fall guy if you just said fall candles.
Yeah, maybe it's my wife's influence, but I've been a sucker for those recently.
Yes.
So
Okay, that's awesome.
yeah, absolutely.
So we're gonna kind of end it with this, with
Yeah.
your patients that are coming to CAPS,
Yeah.
and you've talked about how what they'll expect when they get here.
Yeah.
What's one thing that you want to let people know to bring them into CAPS, and then to of course see you?
Yeah, I think just knowing that how much we care about our patients, that you can get wrapped up a lot in the social media, aspect of, plastic surgery and just kind of everything. But at the end of the day, and one of the main reasons that I wanted to join CAPS as a group is the surgeons we have, the staff, the ancillary, our nurses, our laser injectors, everybody. We all have one goal at the end of the day, and it's to build confidence back in our patients, but also relate to them on a personal level and know that we're here and that we care about them. And that's always our goal at the end of the day, is connecting with patients, making sure that they feel seen, and that we're achieving their goals of confidence and, kind of getting themselves back to where they were. So I think that's probably the most important thing, is just how much we care about our patients on that personal level.
Well, thanks for getting to know you and a
Yeah,
little bit
absolutely.
more.
Thank you. Thanks, guys.